Good afternoon, good evening, whenever it happens to be that you're joining us. My name is Rob Hatton. I'm the Communications Manager for Grey County. And joining me in this update is Jennifer Cornell, our Director of Long-Term Care and Senior Services, and Denna Leach, our Clinical Specialist. Thank you for tuning in to our first recorded family update. For those of you who have been with us for a little while, we've been doing these meeting updates live. And they have been great for keeping everyone, our families, up to date with what's going on. But we thought that we would start changing things up since we were seeing a little bit of a decline in participation in our evening updates. And a lot more uptake in watching our recordings after our meetings. So we're going to be taking that approach and see how it goes. If you are new to tuning into these updates, I would just note that these updates are specific for Grey County's 3 long-term care homes. That's Lee Manor in Owen Sound, Rockwood Terrace in Durham, and Grey Gables in Markdale. And when you do see this video, feel free to forward it on to anyone who might be interested in the updates that are going on at the homes. And today's update specifically, we are recording it on October the 8th. I'm not sure how it got to be October 8th already, Jen and Denna, but here we are right at the start of fall. So with that housekeeping out of the way, I will pass it on to Jennifer for tonight's update.
Great. Thanks, Rob. Thank you, everyone, for viewing this update. We last met virtually on July 3rd, and I agree, Rob, I can't believe we're already in October. So for today's update, I have some announcements and information from the Ministry of Long-Term Care, some Grey County updates, and Denna is here with us with some clinical updates. So starting with the ministry announcements, Ontario Health West released information regarding an opportunity for long-term care homes to submit proposals for potential funding through the Local Priorities Fund. This is a funding stream designed to support long-term care homes by providing assistance for initiatives such as the acquisition of diagnostic equipment, staff training, specialized equipment, and specialized services. The goal of the Local Priorities Fund is to support the specialized needs of existing and incoming residents, prevent unnecessary hospitalizations, and to enable a better patient flow from hospitals to long-term care. Our 3 homes have submitted proposals for items such as IV training and equipment, bariatric lift equipment, and skin and wound care supplies. On September 25th, the Ministry of Long-Term Care announced an investment of $9 million over 3 years to launch a new program aimed at improving care for residents with dementia in long-term care homes. This investment was first introduced last December as part of a proposed suite of legislative and program initiatives to enhance dementia care supports for residents in long-term care. And we've talked about it a couple of times and have been watching for this announcement. So the Improving Dementia Care program uses emotion-focused models of care for residents with dementia. The IDCP will support staff training and new programs for residents in up to 15 homes and is expected to serve 1,800 people in its first year. For over a decade, Grey County Long-Term Care has been providing care and service through an emotion-based model of care that you know and we know as our Color It Your Way philosophy. The deadline for the application to be one of the 15 homes is October 17th, and we are actively working on our application to have an opportunity to participate in this initiative to demonstrate our continued commitment to this approach. The Color It model and promise, I think, fits perfectly with this opportunity. So fingers crossed and stay tuned. Grey County long-term care updates. A number of new team members that I'd like to introduce you to since we last met. In July, we welcomed Nicole Bertrand to the role of RIE coordinator at Grey Gables. In September, we welcomed Amy Brown as the new social worker at Lee Manor, and Nicole Lahid also joined in her new role as social worker supporting Grey Gables and Rockwood Terrace. Terry Fisher has stepped into the role of executive director, while Karen Kraus focuses on operational readiness for the move to the new Rockwood Terrace in 2027. Additionally, Rebecca Smith has accepted the position of permanent resident and family services manager at Rockwood, while Brittany Anasio took the role of temporary resident services manager at Lee Manor. So lots of shifting and changing, and really excited to have all of those team members in their new roles. In August, Warden Andrea Matrasovs and CAO Randy Schertzer and Deputy CAO Niall Lobley and myself had a chance to go and visit all three of the homes. And it was really a great opportunity to introduce or reintroduce the warden and the deputy CAO and CAO to the homes, to tour, to engage directly with residents and team members, and to gain some firsthand insight into the day-to-day operations and the resident care environments. And it was a really great day. I want to just remind everyone about the postal strike. Maybe you don't need to be reminded about the postal strike, but just to remind you that we encourage you to contact your home's office team members to sign up for electronic billing or statements. It helps make sure that you have up-to-date information. Also, the annual family satisfaction surveys have gone out. If you're completing a hard copy, paper copy, if you could submit them by October 14th, since historically, if you did a hard copy, you would be able to pop it in the mail, but that isn't an option right now. And if you're completing the survey by email, the deadline is October 22nd. And please just take a few minutes to complete the survey. It really helps us make sure that we're meeting the mark. And if there are areas that we can improve, then we want to know about that. November is Fall Prevention Month, so all three homes will be participating with some fun educational games and trivia, so watch out for that. And that is my update, and I will pass it over to Denna to give us a clinical update.
Thank you, Jennifer, and hello, everyone. And it looks like I'm in a condo by the water, but I'm in my office. But I want to share with you two clinical updates with you. The first is about our upcoming vaccine campaign, and the other is about the next clinical pathway that will be rolled out at the end of this month. So our team is preparing for the upcoming fall season with our annual influenza, as well as a COVID vaccine campaign for both our residents and team members at all three care communities. And as a reminder, vaccination remains one of the most effective tools we have to protect our residents, many of whom are at an increased risk of complications from respiratory illness. And our homes are pretty active places, so there's a lot of movement, a lot of people coming in, and it's blessed to see visitors and friends and a lot of activity. So vaccines are indeed one of the most effective tools. So along with our robust infection prevention and control measures, all of that help us to reduce the risk of outbreaks and keep our community safe. So we're working on our campaign. If you've not already been contacted, you may soon receive a request for consent for your loved one to receive these vaccines. And more details, including dates, are coming your way for our particular campaign. But I also encourage all the family, friends, visitors to reach out to their care providers or pharmacy to also receive the vaccination. As you may tell, there's a lot of germs around, and I'm suffering for a little one myself here with a frog in my throat. But there are a lot of opportunities for us to make sure our residents are safe with vaccines. And on to the next update. We're halfway through a 3-year project focused on improving resident outcomes as we implement the Registered Nurses Association of Ontario's clinical pathways. And as a reminder, for those of you who've been hearing about it for a year and a half, and for those who are just hearing about it for the first time, clinical pathways are structured, evidence-based guidelines that help our care teams deliver consistent and high-quality care. And it's a partnership we're working provincially and also is supported. I think we're up to almost 500 long-term care homes that are implementing this consistently across the province. And on October 30th, we're rolling out our newest pathway, the palliative and end-of-life clinical pathway. Now, we're pretty proud of the work that we do in Grey County's long-term care. So we have been delivering palliative and end-of-life support to all of our residents. But the pathway itself is designed to support them in a way that is structured and is consistent and coordinated. So, but ultimately what palliative and end-of-life care, it's about focusing on the resident, on what matters most to the resident and loved ones. We, again, deliver compassionate care, but sometimes these can be difficult conversations. So we're really working with our team members to focus on how we can have those sensitive and serious illness conversations in a way that demonstrates empathy, dignity, and respect. And it's coordinated, and it's everyone. Palliative and end-of-life conversations are with everybody in the long-term care community. So it's a role that we're rolling out with our personal support workers, social workers, physicians, our housekeepers, and so that all of us are part of this incredible part of someone's life. And it's transparent. That's why we're having this conversation now, that we're having clear communication, and it's about shared decision making. So again, with this pathway in place, we want to ensure we have earlier and more open conversation about goals of care and wishes. We want to make sure that symptom management and comfort care is at the forefront. And we want to ensure that there are resources and emotional support for residents and their families throughout the journey. And so just to reiterate, we see families as essential partners in care. So if you're hearing things like about palliative and end of life, it may seem challenging, but we know your insight, your stories telling us about your loved one and their preferences are the way that we can best honor their life and legacy. And we want to continue to include all those that matter to the resident in the care planning. And we want to support you every step of the way. So we know it can be a difficult topic, when we're planning as somebody has a serious illness and the trajectory is getting towards the end of their journey. But we're here to listen and answer any questions you may have. And our goal is to ensure that every residence experiences comfort, dignity, and peace, and that families feel supported and informed along the way. So we're rolling out this journey, and we are looking forward to being partners in care. I'm going to pass it back to you, Rob, I think.
Thank you so much, Denna, and that's some very important work that's going on. So I really appreciate that update. And thank you for all of your information as well there, Jennifer. To everyone watching, just because we are recording these meetings now, it doesn't mean that we don't want to answer your questions. It's quite the opposite. So if you want to know more about anything that you heard on this call, or if you have any questions about the update, please reach out to us. You can email communications@grey.ca, or if you receive this update through one of our newsletter campaigns, you can simply reply to one of the newsletters, and those emails will come to my team, and we will make sure that we forward those on and that we get a prompt reply back to you. So if you want to learn more, just email communications@grey.ca, and we'll follow up as soon as we can. Jennifer, Denna, was there anything else that you wanted to add to the call today?
I'll just add to your comments that if you have thoughts or comments about this update being recorded and not live, open to hearing that. We are just kind of trying it out to see how it works. If you would prefer, say, 2 live a year, or just let us know what you're thinking if you have any opinions on that. And of course, if there is an update that we know is perhaps contentious or has lots of unknowns and lots of questions about it, we will do those live to give everyone a chance to do the Q&A. I get a lot out of the Q&A. It helps us know, again, whether we're on the right track. Is there some things we need to look at it from a different lens or think about it in a different way. So please don't hesitate to reach out to us as Rob has described. And thanks again.
Great. Okay, well, thank you so much, everyone, for watching our video update today, and hopefully we will see you again soon. Take care.